people today. They could spend half their lives over 50. That's a lot of living. So it helps to have a wise friend and fierce defender in your corner. A friend like AARP. So your health lives longer.
This is just slow-mo karate?
Just slow-mo karate.
Your money lives longer.
I just bought that.
I just sold that.
And your happiness lives longer. That's why the younger you are, the more you need AARP. Join today.
Welcome to AARP Illinois' virtual event. It's so wonderful to have you with us. AARP is on a mission to connect with individuals across various communities, especially those aged 50 and above. We're here to listen, understand, and address the unique needs of you and your community as we age. Our goal is to enrich your experience by expanding our local activities, providing opportunities for you to discover and engage with all that life has to offer right here in your own community and virtually. As we journey through today's event, we invite you to consider joining our dedicated team of AARP volunteers. It's a chance to make a meaningful impact and help us better serve those 50 plus across the nation. Connect with us and be a part of this vibrant movement toward positive change. Welcome, and let's make this event both fun and transformative.
Hendren, and you are joining AARP Illinois on a virtual conversation on Medicare versus Medicaid, unlocking the essentials for your health. Again, I'm Lori Hendren. I'm with AARP. I'm a Senior Associate State Director, and we're thrilled to have you join us today. And really, today, we're really zoning in on understanding the difference between Medicaid and Medicare and helping you in your journey understanding it as well. We welcome your questions in the comments. Please post it there, and we will do our very best to be able to answer those. Being able to shed some light on this very important topic is our special guest, Steve Andersson. He is an elder law attorney and also a contractual lobbyist for AARP Illinois. Welcome, Steve.
Thank you. It's a pleasure to be here.
Wonderful. Again, if you're going to be joining us as you are on Facebook or YouTube, we ask that you ask your questions or comments and put it in the feed, and our producer in the back end will elevate it to us, because that's why we're here, to be able to communicate with you and help you in your journey and answer your questions to the best of our ability. We will be covering a broad range of topics, starting with understanding Medicaid, where the steps are, what it matters to you, but always during this journey, we highly encourage you to talk to your own attorney, your elder law attorney, your healthcare professional, your own state's Department on Aging, or your area agency on aging to better equip you with the answers locally that helps you. So I'm going to open the floor to Steve. Any opening comments for our listeners today?
Well, thank you, Lori, and it's always a pleasure to be here. The one thing I would say is, well, two things. One is, I have to remind everybody that although I am an attorney licensed in Illinois, this broadcast goes out all across the nation. So you have to take into account that I'm not really explaining Illinois law or Michigan law or California law. I'm kind of giving you an overview of what the law is generally. So you can't take this advice to the bank, if you will. I want to encourage you, if you have specific questions, that you go to a local attorney, elder law attorney or what have you, to try to get precise answers. So that's number one. And number two is, I always like to tell people, it's going to be okay. I think we should actually name this program, It's Going to Be Okay, because the laws in most states are designed to try to protect us with a bit of a safety net. It's not like Europe's safety net where, it's quite expansive, but still in the United States, most of our laws, especially surrounding seniors and estate planning, is pretty well designed. So I like to call this It's Going to Be Okay, but with conversation, with questions, we can do better than okay. And that's the purpose of today's conversation. So thank you.
Wonderful. Thank you. So let's start with questions to you, Steve. And again, if you're listening, make sure you put your comments or questions in for Steve, and we'll make sure we elevate those. So let's start off. What is the key difference between Medicare and Medicaid, and how do they complement or overlap, especially for older adults in coverage?
Yeah, great question. And one that most people misunderstand, if for no other reason than they sound the same, right? Medicaid, Medicare sounds similar. Oftentimes people will come in to my office and they'll say, I want to talk about qualifying for a nursing home. what do I need to do for Medicare? And the answer is not much, because that's Medicaid. There is overlap, though. So the difference fundamentally is that Medicare is like health insurance. Okay. So before you were retired or before you were eligible for Medicare, you might have had a state issued plan, the Affordable Care Act plan, a private employer insurance plan. Well, Medicare, when you achieve, the appropriate age, that steps in. And that becomes your health insurance. So when we think about Medicare, we're thinking about health insurance. And that's, if you're a citizen or you're a legal alien, you are entitled to that. That is something we all get. Even, Bill Gates will get that, when he's the appropriate age. However, Medicaid is very different. Medicaid is an entitlement program based on your income levels. It's basically there for people with low income. So remember, I just mentioned the idea of a safety net. Medicaid is that safety net. So it's all based on, do you qualify based on your income and your assets? So very different. But most people in their senior years, and you're thinking about, aging and nursing home care, most of that discussion is in the Medicaid realm. And a lot of people will say, well, I'm not poor, so I guess I won't qualify. Don't be so fast to assume that. And we're going to talk about some of those qualifications, but you may well be surprised that you might be able to get some benefits from Medicaid, even if you're, a person with some assets. So Medicare insurance, Medicaid, nursing home, low income help.
Wonderful. We have actually a question already. This is great about trying to understand where to get help and what does that look like. Individuals from Naperville, I imagine Naperville, Illinois, caregiver for husband with dementia. Do most elder lawyers offer free consultation in their search for help?
Yeah,
question.
Yeah, they vary. Some of them do. My law firm that I was formerly active with used to offer an hour. So an hour free, and then if you needed more, then we'd be happy to give it to you. But not every elder law attorney does it that way. So it's going to depend. It's a private, most attorneys are private. You could also seek out free legal services in the Naperville area. Naperville, Illinois is covered by Prairie State Legal Services. And so you can Google that name, Prairie State Legal Services, and they may be able to give you some information and maybe even some recommendations if you can pay something, but maybe not, full bore. So
that's great. Okay, so who qualifies for Medicare versus Medicaid, and can someone be eligible for both at the same time?
So the answer is yes to the second part of it. You can qualify for both, and that's very common when we're talking about nursing home care. But let me talk about the individual qualifications first. Mm-hmm. So for Medicare, so this is the insurance part of it. It has very little to nothing to do with your assets. So there's assets and there's income. So on the income side for Medicare, for Medicare, I'm already making my own mistake. I started to talk about Medicaid. Medicare, there are no income or asset limits. Anyone who is a citizen who is in the States, or actually could be anywhere, qualifies for that. Medicaid is where it's different. So for Medicaid, if you're looking for Medicaid purely as like insurance, you don't qualify for Medicare for some reason, or you simply can't afford it. Like there is still, monthly payments with Medicare. Mm-hmm. You can use Medicaid as a health insurance plan as a backup, but it's really reserved for low income folks. We're talking about, for a single individual, we're talking about your monthly gross income has to be less than $1,800 a month. So it's very low. It's like 140% of the federal poverty line. But if you're below that, you would qualify for it as insurance. The more common question is, do we qualify for Medicaid for nursing homes, for example? And there the answer is yes, you can. It depends on your asset level and your income level. I think we'll get into that a little bit more in detail, so I'm going to pause on that right now. But I will say this, that if you're on Medicare All right. So now you have health insurance, Medicare, and you need nursing home assistance. That's where they can overlap and complement each other, where you can receive Medicaid, not for health insurance, but for the nursing home care.
Mm-hmm.
And I should probably mention to folks as well that Medicare does provide a limited benefit for nursing home when you leave a hospital for a period of about 100 days. But that's it. Medicare is not generally thought of as nursing home care. A little bit of recovery or rehabilitation, if you've been in a hospital, they'll cover, but not much more. When we talk about nursing home care, we're really talking about either one, private pay, which means you're using your own assets, or two, Medicaid.
Wonderful. So this is a good question. Let's say your loved one is in the hospital and they're going to be doing rehab.
Right.
And they go to a facility. Is that rehab a Medicare or would that be a Medicaid cover?
It would be Medicare.
Okay.
So for about 100 days. And the whole idea is that it's based on getting better, reaching your maximum medical recovery, if you will. That's a term that they use, maximum medical recovery. So they're trying to get you stable, if you will. And you don't do all of that in the hospital. You do some of it in this sort of a nursing home setting or assisted living setting. And when you do that, the idea is we're going to get you better, or you may actually still come into a nursing home. You might be at your maximum medical recovery, which might not be perfect, by the way. It might be much less than perfect. But it's also designed, Medicare, for those 100 days, that it'll keep you at maximum medical recovery. So without that care, if you don't have it, if you start to drop, that's also covered by Medicare. But again, only for 100 days. After that, if you need to stay, then we're talking Medicaid.
And then that would be if that facility you're in actually has Medicaid beds.
That's right. And that you qualify for it, because not everyone will.
So here's a tricky question. You're in a facility and let's say you get COVID, you get sick, you go back to the hospital, you're there for a week and you come back to the facility. Is this the question? Does the clock start over at Medicare in your rehab, or did it kind of pause and then you finish out your X amount of days?
Yeah, it's a great question. For the most part, it's a pause.
Okay.
There was a time when it was kind of like the clock started again,
Yep.
and that got gamed by providers as a way to just continually get it. And so it's generally just a pause.
Okay. Again, if you're listening to us, make sure you put your questions in the comments and we'll elevate that to Steve. So how does income and asset limits impact your eligibility for Medicaid, and do they vary by states?
Yeah, they do vary by states, that's for sure. I'm going to give you the best example that I can know, which is Illinois. But again, if you're elsewhere, it'll be somewhat the same, but not exactly the same. And so let's talk about where you've got a couple, right? And one person in the couple needs nursing home assistance, but the other person in the couple is still able to live at home. The question is, this is called anti-spousal impoverishment. In other words, we don't want that healthy spouse. And again, even though they're living at home, they may not be perfectly healthy either, but at least they don't need to be in a nursing home. We don't want them to go poor just to provide for the health and safety of their spouse who is in a nursing home. So the idea is the federal government and the states provided for pretty robust exemptions for that from your assets and your income. So if in that situation, you got a husband and wife, let's say that the husband's in the nursing home, wife has income, wife has assets, but she lives at home. She can keep right now, and it changes year by year, $135,000 worth of assets that she has, plus the home. And the home has an upper limit as well in value, but it's pretty high. It's $730,000. So you get to keep your home up to that limit. You get to keep your other assets as well, and still your husband, in my example, would qualify. The other thing you get to keep is your income, or a portion of it. And that income can be just under $4,000 per month. And there are circumstances, by the way, where one of the spouses has all the income and the other has very little. So let's pretend in our example that the husband had all the income and the wife has very little. She can take her husband's income and it goes towards that $4,000 limit. So the whole idea is to make that family unit as whole as we can, even though one of them has to, unfortunately, be in a nursing home.
So we have a great question. From a listener, how is Medicare program funded, and is the funding source at risk?
So Medicare is funded by the federal government for the most part. Right now, I mean, this question probably trips a little into the current presidential administration and their policies. For the most part, Medicare has not been touched in the recent legislation, the recent budgeting process that the federal government has gone into. There were promises made that Medicare would not be touched, and so far, those promises, I believe, have been kept. Medicare, I'm talking about Medicare. Medicaid has been touched, and Medicaid, the person didn't ask this question, but I'll answer it anyway. Medicaid is being touched. Medicaid is funded by both the federal government and the state government, mostly in a 50-50 proposition, although there's this thing called Medicaid expansion that happened a number of years ago, where there's some expanded products where the federal government covers more of it. That is being affected. We don't know the implications quite yet. Specifically, it will vary state by state, and it could vary dramatically state by state. Illinois could stand to lose a lot. Maybe other states not as much, maybe other states more. So that's one that's, one, we don't know fully the implications. Two, each state doesn't yet know exactly where we're going to be at. We probably won't feel those things until after January of 2026.
Okay, thank you. What are the common mistakes families make when planning for Medicaid eligibility, especially related to gifting or asset transfers? I think that's a good question.
That is a very good question. And the important thing to understand is that when you're qualifying for Medicaid for nursing home, this is most specifically for nursing homes. When you're qualifying for that, you cannot give your assets away, right? Because if someone were to listen to the first part of my answer about those qualifications, well, if I have more than $140,000 in assets, I'll just give it to my kids, right? I'm entitled to do that. Well, you're legally entitled to do it, but there's a consequence to it if you're trying to qualify for Medicaid. If you give away assets for no consideration back to you, in other words, you weren't spending it on something. You can spend your money and, get clothes, services, whatever you need. That's totally fine. But if you're just literally giving money away to try to shelter it, you will incur what's called a penalty period. And the penalty period is basically the amount of time that you could have lived on the money, but you can't now because you gave it away. That's the amount of time that Medicaid won't cover you for the nursing home. So let's say you gave away $10,000, and the rough estimate is you could have lived in a nursing home for 1 month for that $10,000. That means when you apply for Medicaid, they will say, okay, you will qualify because your assets are below a certain limit, but because you gave that away, that $10,000 away, we're going to delay your qualification for 1 month, which means now you have to pay privately for that month to survive that month before you can qualify. And it just continues on. So if you gave $1 million away, they'll delay you for many, many years probably at that point.
Okay, good question. All right, so going back to listeners, thank you so much. What are your chances, or is there a way of being eligible for Medicaid if your monthly income exceeds the limit and you're a homeowner?
So if your monthly income exceeds the limit, you can still qualify. What it means is that you will have a contribution that you will need to make for the nursing home. So you'll still qualify. Even though you're living in your home, and I'm assuming the spouse is who we're talking about, who's in the nursing home. So let's say we talked about 4,000 being, it's not exactly 4,000 and it'll vary by state, but we'll use 4,000 as our general rule. Let's say you make $5,000 in a given month. What then will happen is you will qualify, but your required contribution will be that extra $1,000. So you'll still keep 4,000, but that extra 1,000 you will have to pay in monthly, not to the government. You don't pay it to the government. You pay it to the nursing home where your spouse or significant other is located.
Okay. Keep the questions coming. We have about 9 more minutes. These are great, and we're here to help you and have this conversation. Are there legal tools or planning strategies like trust or spend down approaches that can help protect your assets while you're qualifying for Medicaid?
Yes. So the trust thing, a lot of people think if I put my assets into a trust, I will not have to worry about these things. That I'll qualify because all my assets are in trust. They're not in my name anymore. That is not true. Okay. There are trusts that will do what I just said, but they are extremely limited. And the biggest downside of those types of trusts is you lose all access to that money. So you'll lose all control over that. You'll have given it away to someone else and in effect given it away, which again, you can't really do. So that's really, really limited. There are a few circumstances, but I wouldn't rely on that. What I would say is that an appropriate spend down approach is a good strategy. So as you're thinking about either you or your family member needs nursing home care, you can spend on things they want or need. So let's say you're well above the limit. Maybe you want to say, instead of going straight into a nursing home, maybe we want to have in-home care for a while. That's totally acceptable. In fact, the federal government would love that because that means they're not paying for it. So, but you can keep that person in the home, pay that money for that in-home care, spend down by doing that. And only when you reach that $140,000 example I've given, only then would you now qualify, but then you would qualify and you could go into the nursing home at that point. That can be a very legitimate strategy. Now, some people will say, well, but I want to preserve the money. I don't want to spend the money. That's more difficult because, again, that preserving it means you're basically giving it to someone else to have, like your children is very typical. That is much harder because then you incur those penalty periods I talked about. But again, maybe you can survive some of those. If you keep enough money, you can perhaps live through the penalty period. But again, I would encourage you, if you really want to explore that, you really need to talk to an elder law attorney, an estate planning attorney, someone who specializes in your state on Medicaid planning, because it's so precise. Not every elder law attorney does it. Not every estate planning attorney does it. It's very precise, and you want to be careful about that, because if you do it wrong, you're going to lose the benefit of what you're trying to do.
What's the implications of adding a child's name to a home title or bank account in hopes of preserving the assets while applying for Medicaid?
It won't help.
Okay.
What it will, because it's still in your name. And if it's in your name, it's your asset and it's countable. Okay. Now, it does help for estate planning purposes. If you want to pass that house to that child, for example, you can do that. And it will mean there's no probate because you've given it to that child. There are some tax detriments to doing it. There's always something, right, Lori? There's always some qualification, but you can do that. But it will not help for Medicaid purposes as long as your name is on it. And if you take your name off of it, it's a gift, which means you've incurred a penalty period based on that. So again, have to be very careful about that. But there are some things. I want to stress this, though. This is important, is that the idea here is not that everyone qualify for Medicaid. The idea here is we qualify the people who really need it, and we do the very best that we can for everyone else. But that does mean sometimes the best strategy is to live at home, have that in-home care, which is a better quality of living, by the way.
Oh, absolutely.
Enjoy your home, enjoy that circumstance, hire the people, pay the money, do that. And then when you've now gone below those asset limits, now it's time to look at Medicaid and nursing home assistance for that. I want to encourage people to think of it in that way, not simply as a get out of jail free card where you're going to be able to, shelter all this money for your children. The money is there for you and for your care.
It's going to be a change of mindset as well, because you've worked so long all your life, you saved so much money, and now you have to make these decisions. So I have a question. When is really the best time? When we talk about retirement planning,
Right.
I don't know if people really have conversations about that long-term care, because it sounds, little uncomfortable, but these are real tax implications, asset strategies that really early on would benefit you, your quality of life, your care, and even your loved ones around you. As we know, so many of your family members or loved ones are your caregivers.
Right.
When's really the best time to have that conversation and even engage a professional like yourself or someone at Free Legal Services to kind of map out that plan?
Yeah. The earlier, the better.
Mhm.
For example, one strategy, if you plan well in advance, is long-term care insurance.
Mhm.
If you try to buy long-term care insurance, which will then cover you for a lot of what we've just been talking about, if you try to buy it just before you need nursing home care, well, it's going to be astronomically expensive if it's even available. But let's say you do it at 40, long before, hopefully long before you might need it. That might bring the price down to a more reasonable level. What if you did it at 30? I mean, I generally don't see 30-year-olds thinking about this, but it would be brilliant if they did, because you could probably get a pretty cheap policy and then have the benefit of it when you need it. And the reality is I don't know the numbers, I don't know the percentages, but a huge number of us will need at some point during our lifetime nursing home assistance. So it's not a bad bet, if you will. And it would allow you to preserve assets. It would allow you to, gift things to your children, your hard-earned money, things like that. So the earlier, the better is the answer.
And that's hard to consider when you have mortgage payments, you have grandkids, you have your own college, you have car payments, you have healthcare, all of these things, prescription drugs, but then it is something to think about and talk about. So, a question from one of our viewers: what about survivor benefits? Will they last forever?
I think the person is probably talking about Social Security. I'm guessing with
That makes
survivor
sense.
benefits, the answer is yes. If you and your spouse have Social Security, and your spouse dies, yeah, you get the survivor benefits of that. You do want to look, if we are talking about Social Security, you do want to look though at which is better. In other words, you can take your own benefit and you can compare that with what you get as a survivor. One or the other might be better, and there might be a combo plan or two.
Okay. How should caregivers or family members advocate for a loved one navigating in Medicare and Medicaid, especially when the coverage may be denied or delayed?
Yeah. So there's a couple of things. One is, and I'm not doing this, to advertise attorneys. That's not why I
Yep.
do this show. But if you're thinking that that's in the cards, and planning earlier is better, talk to an elder law attorney about it. And there's an organization called the National Academy of Elder Law Attorneys, which is basically a referral service, but you can look in your own state, and find people in your own area who specialize in these things. I would highly recommend that. The other is that, at least in the state of Illinois, we have a program called SHIP, which is Supplemental Health Insurance. What is it, Lori?
It's SHIP. It is Senior Health Insurance Program.
Thank you. And this is a guidance system.
Yep.
It's not insurance. It's people who are very well educated on the options for you, and that's worth it, and it's free. So I would encourage you to, if you Google SHIP in Illinois, at least, and they might have it in other states too.
Yep. And our producer behind the scenes is going to be posting in the comments for Illinois the 1-800 number and the email. And we'll also post in there for you guys the website for Illinois. But like you said, that's a free statewide health insurance counseling to walk you through what is available and how you can get the help. And it's very resourceful. So we would encourage you. So we've come to our half power hour. So thank you so much for everyone that joined, all of you that took your time and your questions. I want to thank Steve Andersson as always. We've been doing this for a couple years, and I am well educated now in many things, but I still have to consult with him because he knows this, and he is so grateful with his patience and time answering these very complicated questions. And I think this is just part of a dialogue we should all be having, and we'll continue to have this every month for the rest of the year. So again, if you have more questions on Medicaid and Medicare, and for valuable information, look to SHIP, SHIP. Also, producer's going to put our link in for Illinois. We want to say thank you for listening. Any closing comments that you may have, Steve?
I just want to say thank you for the opportunity. I love doing this. I love the questions. And remember, it's going to be okay.
Wonderful. Thank you so much for joining us. Please join us for future ones. And thank you so much. Bye-bye.